We'll wait for a couple of minutes and then Samyukta, I request you to please take it forward from there.
Sure, Ali.
Thank you. All right, Samyukta, you may please start the session now. Thank you.
Thank you so much, Ali. A very good evening to all of you. I hope I'm audible. Okay, thank you so much. Thanks to each and every one of you in the audience for joining us today for the launch of the Yash Entrepreneurs Program. My name is Samyukta Prabhu, and I'm part of the healthcare team at Wilgrow Innovations Foundation, and I'll be moderating today's session. I'm really looking forward to hearing from some of the most eminent speakers in the sexual and reproductive health space in India in today's event, and to also interact with all of you in the audience over the course of the next hour and a half. Without much further ado, I would now like to invite Srinivas Ramanujam, who's the Chief Executive Officer at Wilgrow Innovations Foundation, to welcome you all and to also share a brief introduction to the Yash Entrepreneurs Program. Over to you, Mr. Srinivas.
Ali, can you just find out if Srini is able to log in?
Sure.
I believe we're facing some technical difficulties, but until Srinivas joins the event, I'd like to take the opportunity to give a brief introduction to the program. So as you all might already have read through the various posts that we've been putting up in the past 2 weeks, the Yash Entrepreneurs Program is a new initiative by USAID under the Momentum Country and Global Leadership India Yash Project. And it focuses on creating a very strong ecosystem of mid to late stage investment ready enterprises that are addressing critical challenges in the sexual and reproductive health space in India. In India, this program is led by JPIGO, which is a John Hopkins affiliate, and is being implemented by Wilgrow Innovations Foundation. I would now like to hand it over to Srinivas to tell us a little bit more about the program.
Thank you, Samyukta. Good afternoon, everybody. And wishing those of you for whom it is a new year, a very happy new year. For example, it is a new year for me here in Bangalore, or in Tamil. Very briefly, the Yash Entrepreneurs Program, as Samyukta mentioned, is a new initiative supported by USAID under the Momentum Country and Global Leadership Project, which is the India Yash Project, and it focuses on creating a strong ecosystem of mid to late stage investment ready enterprises. And we hope that these enterprises can address critical challenges in the sexual and reproductive health space in our country. As Samyukta mentioned, this program is being led by JPIGO. And we've been fortunate and we've been lucky to be working with JPIGO as Wilgrow looks to foster innovation in this space. We are also very excited to have some fantastic partners in the Principal Scientific Advisor's Office. But as I get there, and I would want to welcome the speakers for the day, Dr. Amit Shah, who's the Deputy Director of the Health Office at the USAID, who's going to give us a keynote address, followed by Dr. Sapna Poti. But I'm jumping the gun. And Samyukta, over to you as you invite Dr. Amit Shah.
Thank you so much, Srinivas. We now have the privilege of hosting Dr. Amit Shah, as Srinivas mentioned. So a brief introduction to Dr. Shah. He's currently the Deputy Director of the Health Office at USAID India and has been a part of USAID India since 2012. As the Deputy Director within the Health Office, he oversees USAID health investments across a variety of sectors, including improving maternal and child health, family planning, nutrition, and WASH outcomes. He also looks into health system strengthening and combating infectious diseases across several states in India. Dr. Shah is a medical doctor and a development sector professional with over 20 years of health sector experience. He has completed his post-graduation in obstetrics and gynecology from the University of Mumbai and his master's in health policy planning and financing from the London School of Economics and Political Sciences in the UK. Without much further ado, over to you, Dr. Shah.
Thank you, Samyukta. Hi, am I audible?
Yes, sir.
Yes, Dr. Shah, you're audible.
Thank you. Good afternoon, all. It's a pleasure to be here to represent USAID and deliver the keynote address at the launch event of the Yash Entrepreneurs Program. In terms of context setting, and for those in the audience who are unaware, USAID stands for the United States Agency for International Development. We are the official development agency for the United States government with operations in across 70 odd countries in the world. In India, our developmental partnership is very strong and it has stood the test of time of over 7 decades in the health sector. The nature of our partnership itself has evolved to reflect India's own growth trajectory. Our work, however, is fully aligned with the national health goals and priorities. We identify problems, challenges, and co-create solutions using a human-centered design approach and then implement rapidly with a range of implementing partners on ground, generating evidence along the way of the effectiveness of our interventions. If successful, then these are then scaled up by the Government of India resources or the state government resources or other sources of funding, including a mix of philanthropic capital and debt funding. We continuously encourage our partner organizations to think bold, think big, take risks as required, but move speedily to match the pace of the central government and state governments to accelerate the health impact. At USAID, partnerships are at the core of our work. Our funding is catalytic in nature. It serves as a risk capital. Through our various programs across India, we work and partner with a range of diverse stakeholders. We try to get all practitioners in the field together and not duplicate, but try to learn from each other, build a community of practice to facilitate cross learnings and sharing of best practices. What happens in India impacts the world. So the lessons from India will definitely help other countries in the region and beyond. So this is just to set the context of our developmental assistance in India. With this backdrop, I would like to share a few thoughts on the importance of today's launch event, how we have drawn upon our own current as well as past lessons in this space to structure this program. Now, everyone acknowledges the fact that there are deep-seated and often seemingly intractable problems facing India's health systems. Everyone also agrees that these need out-of-the-box solutions or so-called innovation. We truly believe that social enterprises offer us these innovative solutions. While social enterprises have a clear intent and focus to generate measurable, positive, social, and environmental impact, they also need financial returns on their investment. As per a recent Health Tech India report, approximately 4,300 plus health tech startups have been founded in India. And of these, only 11% have received funding and only 2% have achieved scale. Now, social enterprises in the health sector have inherently struggled to attract private investors as investments in health are perceived to be risky with uncertain returns. Now, these challenges restrict the health enterprises to deliver large-scale and sustainable impact. We have often found that not enough promising social enterprises are reaching a point of minimum commercial viability, the point at which they might be considered as investable by commercial or even impact investors. From a social enterprises perspective, there is a mismatch between the types of capital that is available in terms of return expectations and duration, and what is needed and appropriate to support their efforts from seed to early stages to growth and to maturity. Now, at best, several social enterprises may underperform their full potential, and at worst, they may stagnate or fail as a result. Scale up or financing actually tends to be concentrated in the early and growth stages. The missing middle, or the so-called valley of death, refers to the lack of funding between these two stages. To address these challenges in the past, actually it was a long time back, 7-8 years back, we had launched a very interesting program called as Camtech, wherein we had partnered with Wilgrow to provide incubation support. We had partnered with G Healthcare, which was providing all that R&D facilities. We had Omidar Network as an investor, and a range of interesting partners to support social enterprises. There are some very interesting lessons that we learned along the way. It's not important only to focus on product innovation. Process innovations are also equally important. Just like incubation, providing acceleration support to social enterprises is also very, very important. Let me provide you a very recent example from the ongoing COVID-19 pandemic, which has been very successful and very well received. During the pandemic, US had set up the world's first ever healthcare blended financing facility called Samrit, in partnership with various government entities, private institutions, and financial institutions to mobilize private capital, support social enterprises that offer high impact solutions, and ensure impact to the most vulnerable populations. In less than a year, we're very proud to share that Samrit has mobilized a capital pool of over 250 million US dollars to offer both grant as well as debt financing to healthcare enterprises, and has so far supported over 20 high impact innovative solutions across the entire value chain of healthcare ecosystem, leveraging more than 10 times of the original grant funding and impacting over 20 million lives across India. We have strong partners with clear roles, whether it is Niti Aayog, Atal Innovation Mission, the National Health Authority, the Principal Scientific Advisor to the Prime Minister's Office, financial institutions such as Caspian, Axis Bank, IndusInd Bank, philanthropic foundations such as Rockefeller Foundation, Crypto Relief India, academic institutions such as IIT Delhi, and even industry associations and aggregators such as NatHealth, who are partnering with us on this Samrit initiative. Problem statement, as mentioned earlier, was clearly defined, and we did not start with wanted to force fit blended financing. We realized the need to institute a strong technical assistance component that was equally important, along with the need for capital infusion that would offer customized solutions and offer a very holistic approach to the holistic support to the social enterprises. Our metrics and criterion for support under Samrit were clearly defined as solutions that benefit the most vulnerable populations and that can be scaled and sustained. These achievements under Samrit would not have been possible without strong partnership with key stakeholders, sharing a common vision, chasing the problem to find the solutions and not the other way around, and focus on the impact and end result. Now, these are the similar principles, or we would like to take the same approach as we launch the Yash Entrepreneurship Program, which is going to be a platform for partnership to support mid to late stage social enterprises. While we have made rapid strides in increasing contraceptive adoption in India, there still exists a large unmet need for family planning. If these unmet needs of contraception are met by providing them with different methods of contraception, then the rate of unintended pregnancy would decline by over 66%. And in this process, you would also be able to prevent significant maternal morbidity and mortality. I'm happy to note that MCGL and Wilgrow teams have combined to develop this entrepreneur-centric incubation and acceleration platform, which will really provide a big fillip to the existing entrepreneurial ecosystem for FPRH in India and create an iterative learning environment for scaling FPRH innovations across India. While more details of this program will be revealed during the course of this event, I would like to highlight the point and reinforce that USAID, although we are the anchor partner for this platform, this is in true spirit meant to be a multi-donor investable platform that will provide opportunity for other institutions to invest in the acceleration platform with the ability to absorb diverse forms of capital, whether it's grant, returnable grant, equity, and so on and so forth. We're excited at the prospect, and I would like to encourage all partners and enterprises to be part of this Yash Entrepreneurship Program and join us in our efforts to make a positive impact. I'd like to end by stating that the ongoing COVID-19 pandemic has expose the fault lines, but also offers us unprecedented opportunity to reimagine health systems. With massive budgetary allocations announced by the Government of India through a range of initiatives such as the Emergency COVID-19 Response Package, the 15th Finance Commission, the Ayushman Bharat Health Infrastructure Mission, and so on and so forth, the time is now to act in a collective manner. Finally, thanks to the Japaigo Momentum team, MCGL Yash team, and the Wilgro teams for all your hard work in building this initiative. And a special note of thanks to the Principal Scientific Advisor to the PM Office and Dr. Sapna Poti, who have been pillars of support. We have received unprecedented buy-in and support from them for partnering with us on initiatives such as Samrid or Yash for funding social enterprises. Thank you all for patient hearing.
Thank you so much, Dr. Shah, for that very comprehensive and insightful talk about how the Yash Entrepreneurs Program was conceptualized. And I'm sure it's especially valuable to those social enterprises which will be applying and will be a part of the Yash Entrepreneurs Program in the coming months. We now have the privilege of hosting Dr. Sapna Poti from the Principal Scientific Advisor's Office, Government of India, to give today's special address. A bit of background about Dr. Poti. She is the Director, Strategic Alliances in the Office of the Principal Scientific Advisor, Government of India, where her primary role is to promote scientific research and development and innovations for social impact, and to address problems of society through industry, foundation, and government channels. She's had a variety of previous stints with the Indian Institute of Corporate Affairs, Tata Trust, and the National Skill Development Corporations. She's also had industry and consulting experience across a variety of firms, including ITC, Hewitt Associates, Deloitte, Toyota Kirloskar, and Crompton Greaves. Further, Dr. Poti is also a Chevening Awardee in 2015. Without further ado, I now invite Dr. Poti to please deliver the special address.
Thank you. Thanks a lot. And it's a pleasure being here today. Both because we have USAID and Wilgro, some of both the partners which have been with us for many years now. And, it's likewise, Dr. Shah, that we also, feel it's a pleasure to work with, with USAID. I'm also in part of the committee of Samriddhi and so on. Largely, I think the partnership works well because of the fact that we are, well-intentioned people trying to work on areas which are very hardly, any operators work at this space. So we have been choosing areas which are challenging. So I think we need more and more such partners to work together on these areas. One is to make policies and implement them, but the other is to look at innovative and out-of-the-box thinking in terms of how innovations can be actually brought to the table and how those can be scaled up and so on and so forth. So that is where most of our efforts have been going. As some of you must be aware of the Office of the Principal Scientific Advisor to the Government of India. It's basically started by Dr. Abdul Kalam. He was our first Principal Scientific Advisor, and our third Principal Scientific Advisor was Dr. Vijay Raghavan. We're expecting the fourth Principal Scientific Advisor sometime in May. We have three large divisions under this office. One is to do with the Prime Minister's Science Technology Advisory Council, which largely works on articulating quantum computing or missions of different nature, waste to value. You have semiconductors and so on and so forth. Science, technology, innovation policies and missions per se are articulated by this particular division. The second one is the Empowered Technology Group, which works with line ministries. They look at their guidelines, their policies, and also suggestions of innovations to line ministries and technologies and so on. The third division is what I head, which is the Strategic Alliances Division. The name itself suggests very clearly that we work on different partnerships and alliances which are strategic in nature. It could be right from something to do with marketing and PR for our startups and for our innovators and researchers, or to something as good as taking innovation challenges to the ground. So there are two large players here. One is the supply side and one is the demand side, and both are equally important for us. On the demand side, we have organizations which are multilateral organizations, or it could be foundations, global or Indian foundations, high net worth income individuals, industries, and so on. On the supply side, we have all the academic institutes of repute, the IITs, NITs, ICERs, CSIRs, AIMS, DRDO, FRI, and so on, and their incubators and startups. The startup ecosystem also includes Startup India, Invest India, Atal Innovations, as well as NCL Pune, CCAM, and so on, will grow, of course, and Social Alpha. So there are private as well as public incubators as part of our ecosystem. So we touch as many science, technology, innovation players as possible in the nation. So these are two large, sets of people that we are managing, the supply and the demand, and we're trying to bridge this gap between the two as far as possible. So how we do it is basically we actively source any kind of opportunity from the demand section, and we look at how we can bring these opportunities to the supply end, so that through a requisition for proposal or by sharing the proposals of the supply side in case we have them readily available, we try and sell those proposals to the demand side. That's how we have managed to garner funding as well as in-kind support and all kinds of partnerships during this entire past 2 years. We were also born because of the pandemic, because as soon as the pandemic hit us, we actually didn't know how to go about innovations, how do we source them, how do we evaluate them, how do we have consortiums for oxygen, how do we do genome sequencing. We had no clue, how to also build a health infrastructure and so on. From that stage, we actually managed to build 52 hospitals across the nation in different states using CSR funding. We managed to develop reagents through the Bangalore Life Sciences Cluster, because we were otherwise importing reagents, which is essentially part of the testing kits. We built different kinds of testing kits, vaccines, and also did BSL-2 labs, and so on and so forth. And we also had, O2 for India, which was a consortium of manufacturers of oxygen PSA plants as well as oxygen concentrators. And we did the entire genome sequencing studies and so on, which was funded by largely Rockefeller, Gates, and Azim Premji, and so on. So the pandemic taught us that if this can be done in a pandemic situation, we could also extrapolate that for different areas. So we worked on sludge management, renewable energy, circular economy, something as good as industrial R&D, business R&D connected to semiconductors, defense microprocessors, and so on and so forth. So several domains, about at least 1,000 plus domains. We completed about 300 such programs, and 1,600 crores worth of opportunities were provided to the supply side. So this is become a kind of a process and a system, and there's a very robust team within the PSA's office now, which is completely geared up to bridge this gap, and they've been helping us, grow this entire division. And we're getting into the third year with a lot of optimism. In terms of family health and reproductive health, there are several technologies that one can source, and we are actually running this entire challenge now, where we look at taking the USAID and We Grow initiative to several institutes and startups, because first of all, we need to take a look at the landscape of these technologies and see what kind of innovations and technologies are already available, which are market ready, which ones are in the lab, which are interesting, and which are at an idea stage, which also could be supported. So that's one, access to this information that we need to provide to this entire initiative. Secondly, large amount of technologies are in two areas. One is the communication area, right? Health or family health communication needs a lot of mobile technologies, apps, videos, radio devices, messaging, and so on. So that's an entire space and spectrum. And then you also have actual delivery technologies, which could include online testing of STI or telemedicine or remote care, AI technologies, and so on and so forth. So there are several of them. I think a couple of innovations, almost all of you would be aware of, are the ones in Maharashtra, Rajasthan, and so on which is called Arogya Sakhi, as well as Asman, which is in Rajasthan, largely to do with diagnosis as well as medical care and so on. So these are two large buckets of technologies which we should be trying to source from different corners, and we'll be pleasantly surprised with the kind of technologies that we would be receiving. During the COVID, of course, there were unprecedented, I believe about 7 million unintended pregnancies, which have not been heard of. And also largely because of lack of access to sexual health services and so on. So these technologies are the ones which should be helping not only in the pandemic space, but also in general when there is great health and so on. E-photograph also is one of those through dashboards and so on. So there are several technologies, but the human touch is also required in this space. So a combination of ASHA workers and A&M workers with teleconsultation would be an ideal bridge. And organizations like USAID Will Grow should also look at how they could do the capacity building. One is to choose the technology, the other is to use human interface. But largely, this entire thing would also depend on the training and the capacity building of these workers on usage of these technologies. Because finally, the data which needs to be collected, the data analysis, AI, etc., will work very well only if the human interface is very authentic and real when it comes to data collection and so on. So, given that this is the situation, we are at step 1 today, where we are looking at different technologies and sourcing them for this particular initiative, and we're really looking forward and quite excited about the fact that we should be pleasantly surprised by the technologies that we receive. Thank you again to a long discussion. Thank you.
Thank you so much for your words, Dr. Poti. We really hope that your thoughts will encourage a lot more partnerships from the rest of the ecosystem, especially apart from the startups, from also the corporate and investor communities. And we're sure that it'll help ensure the success of all the social enterprises that we will support through the Yash Entrepreneurs Program. We can now move to the next part of the launch event, which will be the panel discussion. Today, we're really excited to host an eminent, experienced, and quite a diverse group of panelists who will share their thoughts on how social enterprises can solve some of the most pressing challenges in the sexual and reproductive health space in India, and also help to achieve India's family planning goals. This session will be moderated by my colleague, Dr. Roshan Yadvi, who leads the healthcare sector at Will Grow. Dr. Yadri has been associated with the startup and innovation ecosystem for the last 7 years. He was responsible for setting up and managing the Department of Science and Technology Supported Technology Business Incubator at VJTI Mumbai as its CEO. Earlier, he has worked with the Atal Incubation Center at NMIMS and the DST and DVT Funded Venture Center, which is the incubator at CSIR NCL. Prior to these assignments, he was managing the IPR department at the National Innovation Foundation in Gandhinagar, Gujarat. So far, he has worked closely with over 100 startups from a variety of backgrounds, including healthcare, engineering, agriculture, veterinary, and rural innovations. Without taking too much of your time, over to you, Dr. Yadri, and I request you to please kickstart the panel discussion.
Thanks, Samyukta. Hope I'm audible.
Yes, you are.
Thank you. A very warm welcome to all the panelists for today's discussion. I will now introduce each of the panelists to the audience. The first panelist we have today is Moni Sagar. Moni Sagar is the Division Chief for the Family Health Division at USAID India Health Office. She provides technical and managerial oversight to the reproductive health, maternal, newborn, child health, and adolescent health portfolio at USAID. Her role involves providing strategic planning and vision to a portfolio with a funding of over $90 million US. Thanks for accepting our invite, Moni. Also joining us in the panel today is Nayan Chakravarti. Dr. Nayan is the Chief of Party with USAID Momentum Country Global Leadership India Yash program, which is being led by JPEGO globally. In his previous role, he worked as Director, Partnerships and Advocacy Lead for Asia region with Pathfinder International, where his work was leading and providing advocacy support to India, Bangladesh, Pakistan, Myanmar, and Nepal. He comes with 2 decades of public health experience in advocacy, policy research, and strategic partnerships. Looking forward to your valuable insights today, Nayan. I would like to also introduce the next panelist, Dr. Kalpana Apte. Dr. Kalpana Apte is the CEO of Family Planning Association of India, also known as FPAI, one of the largest civil society organizations in the country, working on sexual reproductive health rights in India. A well-known expert in the field of SRHR and FP, Dr. Kalpana is a thought leader and a champion of SRHR issues and has been involved in strategies to expand the contraceptive choices in India, particularly the newer methods like the implants, injectables, female condoms, vaginal rings, and others. Glad you're joining us, Dr. Apte. And representing the startup ecosystem at this panel, we have Srinivas Ramanujam. Srinivas currently leads Will Grow Innovations Foundation, one of the oldest social incubators in the country, as its CEO. He has over 2 decades of experience in brand management and strategy spanning across various sectors. Srini is passionate about social entrepreneurship and for-profit models that are innovative, scalable, and financially self-sustaining. He serves on various committees, including the Aspen Network of Development Entrepreneurs, also known as ANDI, Startup India, and BIRAC under DBT. Looking forward to your thoughts on this program, Srini. We have Namit Chugh representing the investment community here today. Namit is currently an investment professional at W Health Ventures. W Health Ventures, as many of you might know, is a $100 million fund which believes that technology and artificial intelligence will continue to disrupt healthcare delivery. Namit has spent the last decade in Indian healthcare ecosystem with firms like PwC, Alvarez & Marshall, and Loeb Capital. In his current role at W Health Ventures, he spends most of his time evaluating digital health companies for seed and Series A, Series B investments across the US and India. Thanks for giving your valuable time, Namit. And finally, we have Mehak Malik representing the startup community of this country. Mehak is the co-founder and CEO of UV Health. Prior to founding UV, Mehak worked as an impact VC at Beyond Capital, investing across India and East Africa in healthcare, fintech, and agri-tech sectors. She led end-to-end investment in a small global team where she doubled the fund's portfolio. She was featured as 12 VCs to know in Africa by Venture Burn. So looking forward to hearing about your experience as an entrepreneur in the SRH space, Mehak. So now that we have completed the introductions, I will proceed with the first round of questions to each of the panelists invited today. I request all the panelists to switch on their video and also request all of you in the audience to type out any of your questions that you may have for either of the panelists or the speakers in the Q&A box to the bottom right of your screen. We will take them up after discussion. So starting with the questions, my first question will be to you, Moni. Why is the entrepreneurial approach required to achieve SRH outcomes in this country? So what is so unique about the Yash Entrepreneurs Program? We would like to know more from you.
Thank you, Dr. Roshan. And to start with, I wanted to really break one. Sometimes, people hold this myth that, when it comes to family planning and SRH, government is providing everything free of cost. There are, contraceptive options available. There are services available. Why would you need an entrepreneurial approach in this sector? Government has been providing these services for many years since independence. And that's something, I just wanted to address that with some of the data points. That if you look at the National Family Health Survey, what we see is that access to contraceptives from private sector has really expanded and doubled in the last 25 years. And even now, if you look at where are people accessing contraceptive methods from, more than 50%, almost 56% of the married women are still relying on private sector where they are buying contraceptives. Except for maybe, sterilization, or, in some states, PPIUCD, which is the postpartum intrauterine device. For rest of the reversible contraceptive options, private sector still remains, a point where people are accessing both in the rural and the urban areas. So it's not just an urban phenomena. Even the rural poor, 51% of the poorest rural users are also buying contraceptives. So clearly, this data shows that private enterprise sector can and needs to continue to play a larger role when it comes to addressing, these needs. And there is a business case out there for private sector as well. And not only NFHS 4, but even NFHS 5 data, which is still coming in, is showing that same trend. And so first, I just wanted to address that because many people have this question in their mind. The private sector has a huge market. It is not fully tapped, and there's business potential. The second point I wanted to make is that, the second question people usually have, that India has made so much progress in the last few years. We've achieved a total fertility rate, which is basically, the number of individuals that replace, the existing population. And do we really still need to talk about SRH and FP? And that I wanted to again counter that and say that in spite of all the progress that India has made, there's still significant gaps and variations across states, across districts. And specifically, if you look at certain groups, there's still very high unmet need, which means there's demand, but we are not being able to meet that demand. So that is what we call a gap, that people want to use a contraception, but they are not using it because either they don't have access or they don't have information. So definitely, again, that points to the fact that the new ideas, new approaches will be needed. We will have to look at, non-conventional approaches, because definitely with the existing conventional approaches, we are not really meeting that gap. And innovative ideas and solutions will have to be part of the, the basket that we are offering to the people. We need innovations that can achieve things better and faster. Thirdly, I think some of this, both Dr. Amit as well as Dr. Sapna also covered, that if you look at the entrepreneurial ecosystem, we also realize that while there are numerous startups and enterprises that work in the health arena, the space of SRH and family planning and innovative solutions in that space is still very, limited options, and limited scope has been explored. So there's a lot of technology solutions, a lot of process innovations that can still be explored and can really solve the problem of SRH and FP. And, how do we really work with the innovators to look at that, the changing scenario, the changing population dynamics, especially when we are talking about young people, how they are consuming information, how they are accessing services, that is changing. And, how they are even interacting with service providers is changing. Their family planning needs are changing. The narrative on family planning is changing. It's no longer about, small families or, but it's becoming more of a smart choice to make, a lifestyle choice, a career necessity. So how do we really respond to all of these changing scenarios and dynamics? And that can be really done by thinking about, solutions that are better, cheaper, faster, and a way in which we could really leapfrog those solutions. And I think that's where a platform like Yash Enterprises can play a role. And we really feel that this enterprise-driven approach for SRH needs to be explored more and can definitely, be a game changer. Thank you.
Thanks for your response, Moni. I hope these startups and other relevant stakeholders in the audience have taken note of your points, the insights that you have shared for promoting SRH ecosystem in the country. Thank you so much. My next question is going to be to you, Nayan. See, the Yash Entrepreneurs Program will focus on adolescents and young people up to the age of 29 years as its end beneficiaries. So what does success look like at the end of this program? How would you define the success for the Yash entrepreneurs?
Thanks for having me here. Roshan, I hope that I'm audible.
Yes, yes, you are audible, Nayan.
Perfect. So when I look at how the success is going to look like, so there are three primary things which comes to the mind. The first is, as we are looking forward for 20 best innovative enterprises, and we support them over a period of say 30 months on different aspects, right, from funding, providing mentorship support, leadership, networking. So the first pillar of success would be more many of these near market ready innovations. They reach the stage of scale readiness. So that's the first pillar, or the first pillar of success that we look forward to. The second one is a self-sustaining incubation platform on reproductive and sexual health. We know that if you look at the gamut of the challenges in this country on the SRH domain, it's huge. And so looking at the scale and the magnitude of the problem, definitely 20 enterprises not going to meet the kind of the challenge that it has. So, and this is something that Amitji was also pointing out, that we would need many of these enterprises. This platform that right now, which of course we are very grateful to USAID for the gracious support, which is supporting 20 of these enterprises, to be expanded, and many of these enterprises joining us, so that this platform actually becomes a multi-donor platform and sustain much beyond the project life. So that's the second pillar of success that we look at. The third pillar of success is the host of new innovative solution that gets developed, deployed, and catalyzed through these investments. So it actually means that strength and capacity of these enterprises to sustain through their entrepreneurial journey. I'm aware of that there are many innovators inside this room and will be listening to us also, so which prompts me to raise the bar a little forward and a little higher. We are aware that when we look at the sexual and reproductive health challenges or the burden of family planning, which Moni was also talking about, the burden is definitely unfavorably tilted towards the woman. If I look at the data, so the Gatmacher report talks about the unintended pregnancy. And if you look at the global burden of unintended pregnancy, it's, although there is a trend of coming down, but the proportion of unintended pregnancy stands at around 61%. And this is between 2015 to 2019. And India is no better. So this definitely indicates the less power that the woman has, to control her own body and her own sexuality. So can some of these innovations look forward to address some of these challenges and give back power to these women so that the woman can decide when to get pregnant and how many children she should have? So moving forward, if the 5 states which are momentum country and global leadership, where the most of the investments are going in, these states, if you look at the tribal population, so out of the total tribal population in this country, 43% of the tribal population comes from these 5 states. So can some of this innovation be more targeted so that the needs of this tribal population or similar population which are at risk can be addressed too? So that's one more challenge that we have, and we are looking at the entrepreneurial solution to that. Last but not the least, a momentum country and global leadership India Yash focuses at younger people. So it's from 10 to 29 years. And we know that when it's come to the younger population, they are also disadvantaged in most of the cases. So can some of these innovations be more targeted towards this younger population? And I stop there. Thanks. Back to you, Roshan.
Thanks for your response, Nayan. It will definitely be interesting to see, the various business strategies that will be implemented by some of these enterprises that will select under the Yash Entrepreneurs Program. Thanks for your thoughts. I will now move on to Dr. Kalpana Apte. Dr. Apte, the question I have for you is, what are some of the challenges and gaps in the sexual and reproductive health space that social enterprises need to keep in mind? Because again, this is a niche area, a niche market. And what more could be done, apart from Yash, to further improve this situation? Over to you, ma'am.
Thank you, Dr. Roshan. I have been in the sector of sexual and reproductive health for now over 2 decades, almost 3 decades. And one of the challenges that we have always faced, and I think many people in this room will agree with me, is that there is so limited progress on scientific development around family planning methods, contraceptive methods, or technologies that can really be in the hands of the women or young people. We know that in India, priority is of young people. India is a young nation. Young people are not homogeneous. There are different kinds of young people with different sexual and reproductive health needs, I would say, because the context changes it. We have people who are very well-to-do, and we have people who are really very poor, that they can't even complete their education. And they all have something common, that they are developing as individuals, and they are in a transition, and that transition age itself is a challenging time. And so while we are still in 70 years struggling with ensuring that everyone who wants to use a contraceptive method, regardless of their marital status or whatever, is able to access that, we still haven't been able to cross that bridge. We are still counting numbers which are within the marital status. We are still looking at the whole issue in a demographic way. And therefore, it stands to reason that the technology is not in the hands of people. Then 2-3 things have happened, and you have all alluded to it, that we have had a pandemic. And the pandemic really changed the way people have started responding to technology. Today, almost every Indian knows how to take how to measure the pulse and the oxygen levels. So technology has really reached the hands of the people. And it is also affordable in a sense that, yes, if it is at scale and it is at that level, then probably it is something that can be accessible. So when we talk of access and we talk of the challenges, we need to remember, and I would like to quote you all know Harari at the moment, who said very famously that biology enables, culture prohibits. So culturally, sexual and reproductive health and rights are stigmatized rights. They are all bad rights. According to people at large, every issue within that, whether it is sexual health, whether it is termination of pregnancy, decision by a woman, or whatever it is, or use of a contraceptive method by an unmarried person, everything is stigmatized. And therefore, it again stands to reason that people should be able to use technology to take their own decisions and act upon them. When you look at this issue from a rights lens, then it is really important that we innovate and we think how we can mold the technology to ensure that people are able to use it. I will give you an example that my organization, that's FPA India, we started thinking about it a few years ago, and IPPF, that is International Planned Parenthood Federation, we are a federation member, had floated a big grant towards, as it is known as, the Youth Social Venture Fund, because we believe that young people should themselves find solutions for the problems and the challenges that they face. And so as a part of the Youth Social Venture Fund, looking at the self-care model of WHO, we gave the opportunity for young people to identify their problems, sexual and reproductive health problems, Indian young people, and identify the problems. And then we got along innovators to share the platform with them and said, see here, this is a group of problems. And the problems ranged from many things. There was access to sexuality education was an issue. Language around that was another issue. Some young people wanted to talk about, say, ovarian issues. There are certain medical conditions which a young person may have acne and obesity and so on. So those kind of things were there. And then, of course, there were issues around pregnancy, about ovulation. How do you measure ovulation? Today in this day and age, when through an app on a mobile phone, you can check your oxygen levels, we cannot still understand whether a woman has ovulated or not unless the woman goes for a sonography, ultrasonography test. And that kind of technology is possible because biological changes keep happening. And so we put them all together, the entrepreneurs, you can say, or the innovators and the problems. And we said now, and we also had mentors, experts who were experts in technology. And we put them all together in a room. And over a series of consultations, we had 10 innovators who brought out phenomenal solutions. And Wilgrow was a very worthy partner. I mean, Wilgrow, I have to thank them for being in this space and identifying, being in this space and identifying the areas which will make an idea into a market worthy solution. So I think it's very important that we dream, that we look at, we don't allow ourselves to be limited. My dream is to see that tomorrow there will be a kind of a bracelet or kind of a device where a woman can understand that she is going to ovulate in 24 hours and she will take care of herself so that she will not become pregnant. I think it's possible. That's the innovation that we are looking for. I think it's also important today, a pregnancy test can only happen through urine pregnancy test after say 48 hours or some hours after she becomes pregnant and she misses her period. What if there was a pregnancy urine test which could tell her as soon as the ovum and sperms meet in the fallopian tube? If those biological changes can be measured immediately and she can take, she doesn't even have to take an MTP pill and she can take an emergency pill. So if we foster technology, ill health and debilitation will come down significantly. India has that kind of wherewithal. Indian young people are bright young scientists who can dream and who can do this. The need is out there. People are ready to use technology. All we need to do together is to identify problems, identify expertise, and have people like Wilgrow who can foster this, because we do not know markets. Young people do not know markets, but you know. So coming together, making a holistic program can only help in time to go forwards, because, family planning or contraception, maternal health, sexual health have not been in the forefront of technological advances. And now the time has come that we need to put this in the hands of the people. So I'll stop here and thank you for asking me this question.
Thank you so much for your response, Dr. Apte. I hope all the prospective applicants for the Yash program who are in the audience have heard well and will surely take this message back home and think about how important technology is in today's healthcare system. Of course, we at Wilgrow also have learned a great deal regarding the social enterprises in the SRH and FP space during our collaborative efforts under the FPI Innovation Program and the YSVF Innovation Challenge. I'm very sure the Yash Entrepreneurs program will only add more to the pot of this knowledge. Thank you. Now, since the program is all about startups and entrepreneurs, I now would like to ask a question to you, Srini. See, within the SRH space, the sexual and reproductive health space, there is a lack of scalable solutions, whether it is for enabling behavior change among consumers, service delivery, or technologies that support healthcare practitioners. How do you see this program overcome these and other challenges? Over to you.
Thank you, Dr. Roshan. It is quite exciting to hear the others before me, and I build on their answers. Of course, an entrepreneur or even a social enterprise is not going to come up with magical answers, but what they definitely need is a conducive environment, right? And which is what we hope, thanks to the support of the USAID MCTL program and the support of all the technical expertise that JPIGO has, we want to create that kind of a conducive environment here, Now, why does Wilgrow believe that a conducive environment is a prerequisite? Now, if you've seen the other areas in this country, I mean, India is one of the most vibrant innovation and startup ecosystem in the world. And that's happened because there are a whole bunch of well-wishers. There are a whole bunch of investors for financial capital. There are also different kinds of partners who take solutions to market, who are willing to try it. There are people willing to pay for it. So we need a similar, we want to recreate that similar kind of a conducive environment in this space. Now, so the scalable solutions that we look for, and in fact, I'm also adding in my response to the question that I think a couple of questions are there in the chat box. We're looking at how an individual, like what Dr. Kalpana Apte was talking about, how do we empower individuals? To how do we empower practitioners? To third, also a whole bunch of across delivery systems to deploy in mass. Now, each of them might need a different kind of a channel, a different kind of financial capital, different kind of technical support. This program, along with the kind of people we're putting together, will bring together this coalition of friends and well-wishers. Okay? This effectively will become a safe space or a sandbox for an entrepreneur to try or to establish the product, demonstrate why it should get adopted. It intends to build belief and support amongst both investors and market players that here is a viable, feasible solution. It could be a science-based solution, it could be a hardware or a technology solution, it could be a process-based solution. It might end up creating new jobs, it might end up skilling existing, say, ASHA workers or healthcare workers in rural communities. But all of them need to pass the test of viability and feasibility. That's what we're helping them do. Because frankly, I know Dr. Shah is talking about the statistics in the space in healthcare and investment. I also of the firm belief that there's not enough. And it's not enough because people haven't seen evidence. And here we are, the Yash Entrepreneurs Program is going to create the evidence that this is an investable segment. Right? And we have folks like Namit who are early believers and who have built their thesis, and I know he's going to speak about it. We have folks like Mehak who are already building solutions. Now, if we can help such folks see and support them and help them scale, we also help folks like Namit join us and help them fine-tune their thesis. I think we can make this an as vibrant a space as any other. So it's going to be a mix of coalition building, a mix of sort of patient support, guidance to catalyze this space. Thank you, Dr. Roshan. I hope I have answered your question.
Yes, very much. Thanks, Srini. Completely agree that the importance of all the relevant stakeholders here to actually, ensure that even the SRH is an investable and an attractive sector for the startups, for the investors, for the corporates, and follow-on funders. So now talking about startups, incubators, and investors, since these are all important stakeholders of this program, each playing a very valuable role to ensure this program succeeds. So my next question will be to you, Namit. See, the investors tend to not see SRH and FP as investable areas. So with the belief that they are not viable, difficult to scale, and they do not promise a good return of investment. So what can this social enterprise ecosystem as a whole do to increase the appetite of investors in the SRH and FP space? Over to you.
First of all, thank you everyone for having me. I'm very delighted to be a part of this panel. Just quickly, just doubling down on what some of the other panelists mentioned earlier during the conversation. I think innovation is what Dr. Poti and Moni mentioned. And then access is something again, which Srini and Moni mentioned again, right? So just doubling down on some of these things, the sector is definitely investable and scalable if we were to solve some of these access related issues. And then for me, fundamentally, there are 2 or 3 problems that exist today. And if any of the startups were to solve them, then I'm pretty sure they will attract investor interest. First itself is, innovation around product. So far, we are still talking about oral contraceptives, but in the Western countries, we have already seen, patches, rings, IUD devices, in fact, injectables. So a depot is something which is available in India, but not widely marketed. So injectables are something which are safer to consume, need to be taken just once in 3 months, and there's less rigor attached to consumption of depots. So I think product innovation is something that startups should work towards. That is first, which will solve the problem of really creating access. The second point to me is just the innovation around distribution. And this boils down to an earlier point mentioned, which is around the taboo in the Indian society, and how culture is a prohibitive element for some of these issues. So if we were to create more like a direct to consumer model, and there are examples again in the West, why do women need to go through a gynecologist and then go to a pharmacy and go through this uncomfortable experience of buying a contraceptive? And as someone earlier mentioned, right, we're still looking at it from the lens of marital versus non-marital women, etc. So can there be a direct to consumer model where obviously there will be, given that these are prescription drugs, there will be a online teleconsultation model, but the contraceptives can be delivered direct to the person's house, and the taboo can be taken away. I think that is second. And third element, which is kind of an enabler for both these, is just around education, creating safe spaces, creating peer communities where people can chat, discuss some of these problems. And I also saw one of the questions in the platform here, where someone asked if the solution provider needs to be closer to the innovation hub cities, or it could be anywhere in the country. I think if you are innovating with distribution of direct to consumer, you don't need to be present in a Delhi or a Bangalore. You can be in any part of the country till the point of time the delivery time, etc., is taken care of. And just to summarize some of the things that I mentioned, these are some of the innovations that we've already seen in the US, given that W Health also evaluates companies in the US landscape. So there's a large company called the Pill Club, essentially trying to do this, providing drugs and oral contraceptives and several other forms of contraceptives direct to a consumer's house. Similarly, we have seen 30 Medicines. They have started a unit again looking at sexual health, sexual reproductive health, called NERCs, again providing not just contraceptives, but looking at female hygiene, female contraception, sexual health in a more holistic way. So I think if now the time is ready, we have the technological solutions, we have the enabler ecosystem in terms of delivery, telemedicine, teleconsultation. So I'm pretty sure startups are now geared up to solve for some of these challenges, and I'm very excited to see what innovators as a part of this platform will build. And yeah, that's pretty much sums it up of how I would look at companies. And thank you for asking the question again.
Yeah, appreciate for putting this so clearly, Namit. I mean, having invested in well-known enterprises in the SRH and mental wellness space, namely Visa and Mars, I think WH Ventures has already demonstrated its commitment to promoting SRH and FP at the investment level. So we only hope more will follow the suit. Thanks again. So now, as we are all aware, the primary beneficiaries of this program are social entrepreneurs themselves. And hence it was only apt that we invited Mehak Malik, a seasoned entrepreneur and co-founder of UV Health, to be a part of this panel. So Mehak, my question to you is, as an entrepreneur yourself, what kind of models have you seen among social enterprises or with your own enterprise in the SRH and FP space to attract growth funding from VCs and angel investors that typically serve technology leveraged markets? Over to you, please.
Sure. So I think I sort of resonate with what Namit was saying. Would like to build a little bit on that. So I think there has already been a wave of innovations that have happened globally that we can see and learn from. And I would say India is still maybe 4 to 5 years behind bringing some of these or building some of these technologies and innovations for Indians. Primarily speaking of business models, what I have seen is, there are 3 or 4 main types of models that exist in the space. You can talk about issue areas separately,
but these models sort of address spectrum of issue areas. So there's devices and wearables, right? Which can basically like a fertility monitor or a pain reliever or a pelvic therapy device or even a breast pump that essentially sort of takes one aspect of a woman's journey and makes it more comfortable, makes it more convenient, makes it more accurate, or sort of improves access, basically, right? And we've seen LV, which is doing breast pumps and pelvic therapy, using wearables. We've seen the Ava bracelet, which does ovulation tracking, etc. So that's one type of innovation that has happened, and highly scalable, highly monetizable, because it can be a direct to consumer model. You need good education and awareness. The second is diagnostics. So I think a lot of diagnostics in India today still are offline. You have to go to a lab. You have to wait for 24 to 48 hours to get your result. And even there is no standardization in the way to interpret results. Doctors look at it differently from the way labs look at it, and the patient's really, really confused. So here as well, we've seen innovations like the modern fertility, right, which basically ships you fertility testing kits at home and gives you a very, very clean digital summary of what your hormonal profile looks like and what to do about it. So it's education component kind of combined very neatly with diagnostics, right? Similarly, more innovation, like so I think diagnostics that is at home, discreet and innovative is already happening in the world. And some companies have started taking it to India as well. I think Niramai has done a great job with breast cancer screening. I was reading about a model that makes endometriosis diagnosis non-invasive, which would be a big breakthrough, because on average, it takes women 7 years to get diagnosed with endometriosis, right? And the pain is normalized. So that's the second model. The third is just digital services, right? This can be telemedicine, and it can also be virtual care for chronic conditions. So now this is closer to heart for me, because this is also the business model that I am building, right? At UV Health, we are building solutions for chronic sexual and reproductive health concerns, PCOS being the first concern that we're addressing, with aim to build, get into 10 more solutions in the next few years. So these models, like, I think, again, it's established that virtual care works. COVID has accelerated that. 40 million plus women are already transacting online. So they are digitally connected, aware, and have the ability to pay. So I think anybody who's going after this space or building in this space has a lot of tailwinds to capture. So broadly, these are the models, right, that we've seen. And then I think the core aspect of sort of success is really around how do you make it accessible to the user. So you have to solve for distribution, you have to solve for education and community, you have to solve for affordability to get to the mass market. And then you have to solve for language in some of the cases, especially if it's a digital platform. So yeah, that's sort of my perspective on the business models.
Sure. Thanks, Meg. This was really helpful. I only hope all the other startups attending this launch event have taken note of what you have just shared. And we are very hopeful that there will be other models waiting to be explored as a part of this Yash Entrepreneurs program. Thank you. I know we had one additional question for you, Moni, but I'm mindful of time here. So what I'll do is I'll quickly summarize some of the important takeaway points from this panel discussion. So Moni, you have emphasized that the private sector in the SRH space, especially, is still untapped. And these gaps in the private sector definitely can be filled by innovations that come from these startups, right? And also, Nayan, a very interesting point that you have given is it's not just programs like ours, but also startups in this SRH and FP space. If they have to be sustainable, ability to attract follow-on funding, either from corporates or impact investors, is going to be very important. And scaling their products or services to ensure that it reaches the BOP communities also will make a very big difference on the SRH and FP space in the country. Dr. Apte, very important points from you. The role of technology to promote access to safer SRH products is something I thought was very important. Also, this pandemic, very interestingly, has enabled technology reach the common man. I think that was a very interesting takeaway. And this is an opportunity for all these startups. Srini, the point that I'm taking from you today is that the stakeholder support, which stakeholders being the investors, the corporates, the government, the healthcare systems, NGOs, all of these will be very important to empower the innovators and also to promote the utilization and access of these innovations at the end users and the customers level. Also, it is very important to create evidence for early stage investors. Namath and Mehak, I think more or less you hit on these two very important points. One is that product innovations must be scalable and accessible to attract investors. And somehow the flavor seems to be new delivery models, either be new product delivery models or new service delivery models. So I think these were some of the important points that I have taken. I hope the audience also has taken a lot of important points from what you could interpret. Thanks once again. Thanks once again to all the panelists. And I think with that, we come to an end of this session. This has been an extremely fascinating conversation, and I'm sure that all of you in the audience have taken away a great deal from the speakers' experience and valuable insights. We will now take some questions from the audience. Let me just quickly see if we have. Okay, keeping again mindful of the time, I will take 3 important questions, but I can definitely assure we have all the other questions with us in the database here, and we'll reach out to each of you with the responses. Right, I have a question I think which is open for all the panelists, and this is from Arun. His question to all of you is, all panelists have underlined, right, the massive headroom for innovations. But then what does innovation in the SRH and the FP enjoy adjacency with?
I can pick this up, and then Mehak briefly touched about it, right? When you talk about women's health in general, and here we're talking about sexual health. So there are several issues, not just family planning and contraceptives that we were talking about, but there's endometriosis, there's pelvic therapy, both the issues that Mehak mentioned, and then within our portfolio, we have seen sexual wellness as an issue, both for men and women. So there are several spaces. If you look at the journey of a woman's health care needs from let's say puberty to menopause, there are several spaces that startups are now trying to look at. So that I think there's no dearth of adjacencies if we have the right audience and the target identified.
Sure. Okay, I think I see other questions in the box, but I think most of them have been answered by one of the panelists, and we really have no other questions in the question box. And also keeping again mindful of time, I think I'll just proceed to the next part. Over to you, Samyukta.
Thank you so much, Dr. Roshan. I noticed that quite a few questions that were in the chat box were also regarding the sub-themes that are part of the Yash Entrepreneurs Program, as well as the support that you'll receive. So I think that moves us quite nicely into the next part of the event, which is the launch of the microsite for the Yash Entrepreneurs Program, which answers a lot of these questions. I request my colleague Ali to please play the launch video.
Sure, Samyukta, thank you. Is my screen visible to all?
Yes.
All right, going ahead.
Thank you so much, Ali.
Okay.
So just to recap a bit as shown in the video, for those in the audience who would like to know more about the Yash Entrepreneurs Program, specifically the sub-themes that are a part of it, the benefits that you can get by being a part of the program, as well as the evaluation criteria, please visit the website www.wilgrow.org/Yash Entrepreneurs Program, which I'll be putting in the chat box as well. In case you have any other questions after going through the website, please feel free to email us at yep@wilgrow.org, which I'll also be putting in the chat box. The applications are now live, so you can apply at any time, and they will be open till May 15th, 2022. I'd now like to invite Dr. Roshan to please tell us a little bit more in detail about the Yash Entrepreneurs Program.
So thanks, Samyukta. Let me just share my screen. Is the screen visible?
Not yet, Dr. Roshan.
I believe it will take a couple of seconds.
Yes, it's visible now.
Okay, thank you. So a very good evening once again to all in the audience, the prospective applicants, especially and partners. So the Yash Entrepreneurs Program that we are launching today is primarily supported by USAID Momentum Country and Global Leadership India Yash. In India, this program is led by JPEGO and implemented by Wilgrow Innovations Foundation. And as you have heard before, earlier in this program, the focus is on creating a very strong ecosystem of mid to late stage investment ready enterprises that will address the critical challenges in the SRH space in the country. Okay, I'm changing slides, but I think there is.
Should I take it forward, Dr. Roshan? Should I share my screen?
Yes, Ali, I think that will be easier.
Request you to please stop sharing yours.
Sure. I'm sorry, I think we have a tech problem here. So meanwhile, Ali, till you share the screen, let me just brief on the program. So the key objectives of the program is basically to develop an entrepreneur-centric incubation and acceleration platform, and also accelerate the existing entrepreneurial ecosystem in the SRH and the family planning space in the country. And the larger goal would be obviously to create an iterative learning environment for scalable FP and SRH innovations in the country. So this program, we will be actually supporting startups under 5 thematic areas. Okay, I think we have the presentation here. So Ali, you can move to the 4th slide, please. Yeah, thank you. So as I was sharing, the Yash Entrepreneurs Program will be focusing on supporting startups and social enterprises, focusing on these following 5 thematic areas, namely menstrual hygiene, contraception, SRH and mental health, SRH and climate change, and cross-cutting levers for SRH. The bigger goal here is to focus on those startups which have technologies, innovation-based technologies, or innovation-based products or services, right? The website gives more details on the sub-themes, the nature of problem statements, the nature of products, the nature of services that we will consider to support under Yash Entrepreneurs Program under each of these thematic sectors available on the website. Can we move to the next slide, please?
There's some tech difficulties. It's not moving, Dr. Roshan.
Okay, I'll probably. All right. So what we'll be planning to do in this program is to actually create an entrepreneur-centric incubation and acceleration platform. So we will be guided by a strategic advisory group that will, show strategic direction both for the program and for the entrepreneurs that we onboard. Under the incubation and acceleration hub, we will ensure that there is cohort-based learning that focuses around human-centric design, preparing the startups for investment readiness. There will be organization development and operational readiness, ensuring startups have a very good understanding of business and financial modeling, ensure there is a very good strategy for business development, and engage with the youth, the family planning, and the some of the government branches that deal with SRH and FP and in the healthcare sector. We also will be providing the startups with experienced entrepreneurs and mentorship groups. These are basically the subject matter experts and entrepreneur-led monitoring and mentoring, entrepreneur-led mentoring. And finally, we will also focus on building ecosystem linkages with the various partners that will be a part of this program. We already have identified some of the partners. These would be NGOs, these would be hospitals, primary healthcare, and a lot of these, social organizations that are working in tier 3, tier 4, and down the line. Next slide, please.
It takes a couple of seconds to move to the next slide. Sorry for the delay.
Okay, this is the program structure. So the goal of Yash Entrepreneurs Program in the next 2 cohorts, of course, we'll start with the first cohort soon, but the idea is to support 20 startups, 20 social enterprises across 2 cohorts, and each cohort will undergo an incubation program that will last for 9 months. And out of the 10 enterprises that we onboard in each cohort, we will identify 3 startups, up to 3 startups that will get acceleration funding of up to 1 CR. Right? I'll come to the more specifics of what benefits will be provided to the startups under this program. But sometime once the cohort first is onboarded and the incubation program is underway, we'll also announce the call for applications for cohort 2. So ideally, at the end of this program, we will be looking at least 20 startups, 20 mature to late stage startups that will get the benefit of the incubation program. And out of these 20, up to 6 will be identified and they will get the acceleration support. Can we move to the next slide? I'll talk about some of the very specific, so what kind of, innovators will we be looking at, as a part of Yash Entrepreneurs Program. So we'll be looking at startups or social enterprises or even innovators that come from a pharma or life sciences, medtech and devices, digital health, care delivery, care enablement, and health finance. Of course, as an entrepreneur, we will be looking both at what you are offering and who will your customers be. When I mean offering, it could be products, technology-based products, innovation-based products, or technology or innovation-based services. right? For example, it could be drugs, vaccines, diagnostic devices, tools, right? Apps, digital apps, and so on. Also, we'll be looking at some of the fintech-based technology innovations that can play a role in improving the access to the SRH or FP-based products and services. When we're looking at customers, we're looking at those startups who are trying to reach out to the government. They may have either B2B, it could be B2C, direct to consumers, right? It could be even providers. For example, if your customer is a hospital or a doctor who's actually going to be using that product or service. So these are just some of the innovator archetypes that we are looking out for to be onboarded on this program. Can we move to the next slide, please? So the evaluation of proposals. Once we receive your application through the Yash Entrepreneurs Program portal, which has been shared on the chat box, we will evaluate proposals mainly and assess these applications at an organizational level. We'll be looking at the robustness of the innovation. Ideally, it has to be TRL 5 and above. We look at the feasibility of the innovation to scale. Also looking at the existing evidence to build on the reliability of the technology. We'll also look at your business models and how robust they are, the financial viability, and most importantly, the potential to create an impact in these, some of the BOP, the tier 3, tier 4 kind of communities. Next slide. So what will be the key incentives that our startups under the Yash Entrepreneurs Program achieve? First and foremost, you'll get access to the networks of investors and knowledge partners. Second, you will also get access to what is uniquely known in the Wilgrow culture as diagnostic panel, where every 3 months, we will identify some of the main challenges. It will be a diagnostic for your startup. We'll have subject matter experts or mentors who will actually help you solve your challenges through a 100-day plan. Of course, most importantly, seed funding. Yash Entrepreneurs Program under the incubation part, each of those 10 startups will get access of up to 10 lakhs as a technical, technical assistance support. And out of these 10, 3 viable and scalable solutions will get access to up to 1 CR under the acceleration program. Also, you will get access to the go-to-market partnerships that Wilgrow has built, along with access to the partnerships under JPEGO programs. You will get access to technical assistance and sector and functional experts to mentor your startups and handhold to overcome some of the challenges that you will face. The next slide. These are just some of the important deadlines. The applications, of course, will go live. The application portal goes live today. So basically, you can definitely have a look at it. There is a way that you can save applications, halfway and then continue at a later point. But please do visit the website for all the details and eligibility criteria. The applications portal will be open until the 15th of May. Once you submit and once we receive the application, there will be a pre-selection process until the 5th of June. We will, of course, screen applications and shortlist for an interview phase, which will happen between the 6th of June to the 15th of June. And finally, those shortlisted enterprises will be invited to give a pitch. And we are hopeful that the jury panel will be able to recommend the top 10 startups for this program. And we are hoping that we'll be able to onboard these 10 startups anywhere between 16th and the 30th of June. Thank you. So for more details, definitely please do visit the microsite, which is www.wilgrow.org/Yash Entrepreneurs Program. If you have any doubts, do reach out to us at YEP, which is Yash Entrepreneurs Program, YEP@wilgrow.org. I think that is all I have to share. Over to you, Samyukta.
Thank you so much, Dr. Roshan. I now invite Arun Venkatesan, the co-founder and CEO of Wilgrow USA, to please deliver the closing remarks, after which we'll be having an Ask Me Anything session. A little bit of background about Arun. He, as I mentioned, is the co-founder and CEO of Wilgrow USA. And before that, till June 2019, he was the CTO of Wilgrow Innovations Foundation, leading our health sector investments. He has over 15 years of experience in materials R&D, device development, and forward integration of technology into tangible, marketable entities. Without further ado, over to you, Arun.
Thank you, Samyukta. Just to add to what Samyukta said in the introduction, Wilgrow India and the regional entities in Kenya, Wilgrow Africa, and Philippines work on incubation solutions, incubation activity in the regions, and stitch the ecosystems together. And Wilgrow USA is anchoring this need for integrating and synthesizing all this effort into a global network. So Wilgrow US's objective now is to synthesize this and build a global network of impact incubators and bring all these incubation activities together. And from that point of view, I'm really going to be looking forward to the innovators in the Yash program and look for globally applicable solutions and solutions that can be planted in other global markets and scaled into other global markets. In this panel today, in this session today, it was very exciting to be part of this. Wilgrow US is happy to be a partner here and facilitating the execution of this program in whatever way possible, supporting Wilgrow India's role here. So I'm happy to be part of this panel. I want to start out by thanking Dr. Amit Shah, Deputy Director of the Health Office of USAID India, for his keynote address. And Dr. Shah brought out the need for utilizing social enterprises for their out-of-box solutioning, but also balancing that with the return potential. He highlighted the type of capital versus the risk that these social enterprises present, the type of capital needed for them at various stages versus the risks they present. Also, the need for the missing middle to be addressed with the appropriate funding and the real potential here for us in this post-pandemic era to actually reimagine health solutions, right? That was a great point that he made. I thank Dr. Amit Shah for all those interesting perspectives that he brought to this group. I want to also thank Dr. Sapna Poti, Director of the Strategic Alliances in the Principal Scientific Advisor's Office, Government of India, for her special address. She was she actually brought to the surface the need that in addition to the tech and product-based development, we need to develop the human interface. For example, interfacing with the ASHA workers and all that, so that the human capital in this whole effort is well utilized, for data collection and the last mile delivery. So innovation, we always say that in the health sector, the last mile delivery makes or breaks a solution. And so very happy that Dr. Sapna pointed that out. I want to thank all the panelists, Moni Sagar, Nayan Chakravarti, Kalpana Apte, and Namit Chugh, and Mehak Malik for representing this diverse ecosystem that is required to make this program successful, right? Each one of them represents one key, let's say, spoke in the wheel, so that the solutions actually reach the masses and create impact. While they are just my family, I should also thank Srinivas and Roshan for anchoring this, for bringing this together. I know the amount of hard work that the health sector team, guided by Srinivas, has put together to bring this program to fruition, along with with the Momentum Group and JPIGO, with the blessings of USAID. So I want to thank them also for anchoring this panel. The panel brought some very interesting points about the, I start with a lack of even a language, a standardized language for these underrepresented communities to address the aspects and issues in this sector. I remember there was some innovation we tried many years ago in that area. There is an innovator who works on even formalizing the language for this. But in addition to things like that, even I'm glad the panel highlighted the potential for private sector to address FPRH needs. The importance of this self-sustaining incubation platform that Will Grow is creating, but more importantly, the need for continuous support through the growth of growth stages of an enterprise, but also sustainable support beyond this program. Panel highlighted the need for scientific development in this field so that there is clear basis for all the solutions, the tech solutions that are produced. More importantly, the use of tech to remove stigma in this sector, which is, I think, at the top of everyone's mind. I'm happy that the panel also brought out this effort, actually creating a sandbox for entrepreneurs in this sector, and more importantly, generating and creating evidence that this is an investable sector, right? Fostering innovation in product, but also expand that innovation to distribution and education aspects of this sector. The need that, to sort of distribute and democratize these solutions, since all diagnostics, prescriptions, and even interpretations are all very centralized and non-standard. There's a great potential to sort of democratize that and spread this across the value chain. Just want to conclude by inviting the various stakeholders. Of course, this is not possible without active participation and drive by the social enterprises in the sector. So please look forward. I look forward to your participation. I speak for my colleagues here saying, Will Grow colleagues here saying, ping them, bother them, annoy them with questions and be part of this and make sure this platform converts into impact for society. Dr. Shah pointed this out, and I'm going to use his terms. This is a multi-donor investable platform. So I request all members of the investment communities to explore with us ways of participating in this, ways of pumping capital into this endeavor. We have plenty of ideas on how to make this sustainable and how to create returns. So talk to us, reach out to us on any of these social media platforms and keep the conversation going. The last mile delivery is very important, and keep folks who make that happen are the NGOs and corporates. Private sector was highlighted as one of the ones with the biggest potential in accessing this market, in addressing this market. So NGOs and corporates, I request you to be part of this journey in multiple ways. Talk to us and engage with us. And there are multiple ways of making this program all inclusive. If you have ideas for partnerships, in addition to ideas, right, for products and solutions, if you have ideas for making this partnership even broader, do reach out to us. We're always in the lookout for partnerships. So with that invitation to participate in this program, I'll hand it back over to Samyukta to bring these things to conclusion. Thank you, Samyukta.
Thank you so much, Arun, for that. We will now move to the Ask Me Anything session, which will be the last part of today's event, where anyone from the audience can ask us any specific questions that you might have about the Yash Entrepreneurs Program. As previously requested, please put in your questions in the Q&A box, which is at the bottom right of your screen, and we will take them up. I am aware that we are slightly over time, so we might not be able to answer all of the questions, but rest assured, we will get back to you after the event via email. So I think we'll go on for about 5 more minutes. So feel free to drop in your questions in the Q&A box. So I believe there were a couple of questions that were asked and answered already by Srinivas. I'll just read them out in case anyone else probably had the same question, so that you can see the answer as well. So Arundhati asked if we would consider a focus on menstrual health rather than menstrual hygiene and on alternative products, as well as supply chains for sustained access to these products. So Srinivas has answered this question. He mentioned that we are in fact looking at a broad spectrum of solutions across sciences, across technologies, and across service models, which address different issues in the SRH, FP, and mental health space. Um, and even if a particular issue is not being covered in the first cohort of the program, we will definitely scale this platform in the second part and cover the other challenges which we may not have in the first part. But there was also a question previously which spoke about if an NGO can be eligible for this project. So as Srinivas mentioned, this program is aimed at supporting self-sustainable innovations and business models. So it's more likely that these models will be for-profit rather than non-profit. So our focus is currently on for-profit startups as well as mid-stage SMEs.
Samyukta, if I may add to that comment.
Yeah, please go ahead.
I think there is scope for partnerships, so that solutions that these enterprises bring out are delivered to society. So there is scope for partnerships with NGOs. Maybe direct involvement might be require some more definition, but I think partnership is definitely possible.
Yes, definitely. And we would encourage all NGOs and allied organizations in the SRH and FP space to please write to us at yp@wilgrow.org. Or as Arun mentioned, you can definitely reach out to any of us over any of the social media platforms. And it would be great to have you as part of the Yash Entrepreneurs Program to support all of the startups that we will be onboarding. So Sachin mentions that he missed the first half of the session. We'll definitely be uploading the recording of the session to our platforms afterwards. So in case you missed any part of it, please do watch it later. All right, I don't see any other questions as of now, but we'll definitely be hosting another AMA session sometime over the course of the next 1 month before the applications close. So do feel free to join in then. And until then, you can always write to us at any time with the questions that you have at yep@wilgrow.org, as well as have any of the questions that you might have clarified through the microsite, which is wilgrow.org/Yash Entrepreneurs Program, which I'll be sharing in the chat box again. I think we can wrap up the session for now since I realize we're already 13 minutes over time. I'd like to thank each and every one of you for your time and attention to be a part of the Yash Entrepreneurs Program launch, especially at such a late evening time on a Thursday night. As I mentioned, the application portal is officially live now and will be open for another month till May 15th, 2022. So we encourage all entrepreneurs and startups to apply as soon as possible. If you have any other questions, comments, or suggestions, please feel free to reach out to us at yp@wilgrow.org. Thanks again, everyone, and I hope you have a great long weekend ahead.
Samyukta, ending the session now.